Welcome back to the second session of today. The title of this session is The Digital World, Friend or Foe? My name is Vic Marimutu. I'm a child and adolescent psychiatrist at KK Women's and Children's Hospital, and for my sins, I'm your moderator today. So welcome again. So we heard in the previous session how we are hearing more and more young people are struggling with mental health difficulties, be it distress or symptoms. We're also hearing that it's a real need to understand and tackle the underlying contributors to poor mental health. And more than that, we need to find a way to expand resources so young people can get access to timely care. And it's these two last areas, contributors to poor mental health, as well as the need to expand resources, that form the trust for the topic of this session, the digital world. The digital world, metaphorically speaking, is like a coin with two sides. On one side, there are more and more concerns about how, with excessive screen time, young people online for quite a long periods of the day, as well as social media use, can have a negative impact on their mental health and well-being. And on the other side of the coin, we have all that potential goodness, the way that we can reach out to more people and actually deliver some really good intervention digitally. So there's two sides to this coin. And what we aim to do in this session is explore it in a bit more detail. We'll start off by hearing about how and why adolescents may be impacted by social media. We'll then go on to look at the good side in terms of digital mental health interventions and examples of this. We'll look to the future and see what innovations have in store for us up in the horizon. And lastly, we'll go into how can we minimize harm from social media and make the online world a safer place. So without further ado, I'd like to introduce my very eminent group of panelists today. We have with us, via the magic of the internet, Professor Susan Sawyer. Welcome, Professor Sawyer. Professor Sawyer is Director of Center for Adolescent Health at the Royal Children's Hospital. She's also Professor of Adolescent Health at the University of Melbourne. Thank you very much, Professor Sawyer, for joining us. We also have Professor Sonia March. Morning, Professor March. Good morning. Welcome. Professor March is the Director for the Center of Health Research at the School of Psychology and Wellbeing, the University of Queensland. Welcome and thank you for joining us. I'm very pleased to introduce Dr. Tan Weng Moy. Dr. Tan is the Director as well as co-lead of the Integrated Health Promotion at the Ministry of Health's Office for Healthcare Transformation. Welcome, Dr. Tan. Thank you for joining us. Good to see you. And last but not least, here in person, ironically from, Miss Olivia Chong from TikTok, here in person, rather than electronically. Miss Olivia Chong. Miss Olivia Chong is a policy issue manager at TikTok's Trust and Safety team. And this is a team that looks into global content policies involving suicidality, self-harm, and dangerous acts. Welcome, Ms. Chong. Welcome, everyone. Thank you for joining us. So before we delve into our session, I'd like to invite the audience, both here as well as online, to post their questions on Pigeonhole. It should be coming up on our screens and the QR code, and we'll be addressing the questions at the end of all the panelist sharings at our Q&A section. Okay, so without further ado, I'm going to invite Professor Sawyer to tell us a bit about how and why in terms of adolescents and how they may be impacted by social media and what the evidence is telling us right now. Over to you, Professor Sawyer.
Thanks so much, Vic, and I'm so thrilled to be able to join you, even though I would much prefer to be there in person, particularly given that it's very cold and wintry in Melbourne, Australia at the moment. And I was particularly pleased to participate in the earlier session as an observer because the earlier speakers were just fabulous and they've just set up this conversation so beautifully. But I wanted to take us back in time and think about Harry Potter and what we can learn about adolescent development from Harry Potter, because these young people, and I'll remind you that in the first Harry Potter movie, they were all about 12, and in the last one, as you can see here, with these wonderful young adults, they were all in their early 20s. And over this course of adolescence, for those at Hogwarts pre-internet age, They were remarkably attuned to each other. Their world was shaped by the powerful adults around them who acted in incredibly protective ways. And this group of young people were exposed to the dark arts, to some very dangerous social and physical environments around them. And on behalf of their families, it was their school and their communities which really acted to keep them safe, in the context that, in terms of what we've heard from previous speakers about adolescent development, that these young people were absolutely engaged in wanting to stand out from their families, fit in with their peers, measuring up and taking hold and moving out into the world ahead. And if we think about whether they joined Slytherin or Gryffindor, we can again think of the cultural context of what shaped some of those behaviours, both positively and negatively. Next slide, please. But if we fast forward now, next slide, please. If we fast forward now, we can appreciate absolutely the impact of social media, as Vic said in his introductory comments, incredibly in terms of digital interconnectedness as a force for good. Just think of all of these amazingly positive ways that young people can be connected with each other, connected with the world, the development of skills on one hand, and if I can have the animation, please, on this slide, but also, as Vic has beautifully articulated, a sense that this is also a force for challenge. Can I have the next? Thank you. There's obviously a delay with these. So in terms of a multiplicity of health issues, not just in terms of poor mental health, but loss of sleep, physical activity with its impact on overweight and obesity, the challenge of social comparison, the particular challenge of bullying and social exclusion, sexting, access to pornography, the impacts on poor mental health, poor school grades by young people spending so much time on social media. Vic beautifully articulated what I was going to say about this is a two-sided coin, a two-edged sword. Next slide, please. So when we think about what we can learn from the academic literature, in addition to this incredible explosion of access to digital media, there's equally been a staggering increase in empirical studies on the effects of social media use on adolescent mental health. And I've put up this study here, this slide, and the next slide is for this particular umbrella review, as it's called. It was simply reviewing reviews from 2019 to the middle of 2021. And as you can see here, there were 25 reviews that these authors studied. This is an incredible wealth of literature, not individual studies, but reviews. Next slide, please. And in these reviews on the left, they really articulated a very broad suite of challenges, particularly about challenges around the definition of frequency and type of social media use. But importantly, what they demonstrated from their meta-analytic evidence is that social networking site use is only weakly associated with higher levels of their language of ill-being, poor mental health, but was also associated with higher levels of well-being, suggesting that ill-being is not simply the flip side of well-being or vice versa, and that both outcomes need to be investigated in their own right. There was considerable variability in the associations, and they really called for a lot of future research, which is obviously taking place at the moment. Next slide, please. One of the things they called for is longitudinal studies. So I then did a quick review of, well, what can we look at the reviews of longitudinal studies, because these studies are much more powerful than cross-sectional studies that just look at associations or correlations. What's the causal direction here? Might people who have poor mental health be much more likely to engage in frequent social media use, or is it causal that frequent social networking site use, for example, leads to depression and anxiety? There were 14 longitudinal studies that they looked at. Importantly, they suggested that there was some difference in terms of the nature of use, the type of use, where passive use rather than active use was viewed to be more negatively correlated with poor mental health, and that rather than just thinking about frequency or time spent. Importantly, there were no consistent effects by gender. Next slide, please. And finally, this is one of our own studies, because I put this up because it's a quality longitudinal study of around 1,100 adolescents who were first studied when they were children in grade 3 and have then been surveyed annually. And importantly, in this study that I have a lot of confidence with, when they were surveyed annually, this was looking at an hour a day of social networking use being considered high use. So it's a very low threshold versus less than that. In cross-sectional analyses, females with that level of use had twice the risk of depressive and anxiety symptoms, which was not quite as high as for males who had 1.6 times the odds. But in the prospective analyses, there was increased odds, there were increased odds of depressive symptoms at the age of nearly 15 in females who had high social networking use at any of the previous waves, whether at one previous wave or at 2 or more previous waves, after a set of comprehensive adjustments. These were not seen in terms of boys. Next slide, please. So my last slide is simply to summarise by saying there are no simple findings. These are just depression and anxiety, but it's very broadly reflected in the wider mental disorder literature as well. And there are similarly no simple solutions here. There is not a bullet here that we can sort of shoot and say, okay, I got this problem fixed. I think it's just like everything else we need to be doing with young people, thinking about digital media, friend or foe. We need, as adult communities, to be thinking about how do we both care and protect young people whilst equally supporting their engagement and empowerment in the utilisation of digital media, social networking, and that this needs to be shaped in the context of young people's families, very strongly in the context of schools and the communities and the culture that is propagated in schools and the rules that gets established by schools for social media use. And in the context, and I'm delighted that we have a representative from TikTok here, because I do think it's then framed in relationship to the sorts of legislative frameworks and legal aspects that we put together, both within community legislation, but also how is it that individual companies legislate their use, that we're obviously seeing at the moment very much in terms of Elon Musk and Twitter, and whether Trump's going to be allowed back onto Twitter as a platform. These are really important aspects for us as communities to be taking charge of, not simply leaving it in the hands of business and commercial entities. I'll leave it there. Thank you very much.
Thank you, Susan, for that wonderful sharing. I guess I can speak from a clinician, and I see a broad range of young people. And I hear what you're saying about the research, and I think it's not simple. It's not so clear at the moment. I hear you, and I think Dr. Priya, who previously was in the last session, said it very nicely. It's not rat poison. It's not. I love the analogy. I think it's great.
I thought it was the best analogy. Absolutely.
I'm going to use that over and over again.
Yeah, likewise.
But I think what I see from a clinical standpoint, if I may just say, is I see young people across a broad range, and I see young people who are just beginning to have some difficulties. And when you look back at their time before their difficulties, they're spending a lot of time online, and the parents are I guess, okay with it. And I think it's that displacement. So if you're not doing the stuff you do as kids, in going out and having sleepovers and being outdoors and forming closer relationships, and you're doing this, you're not having the same development, the same opportunities to go through some of the difficult things in life and learn from it. And then when something happens, all that gets magnified. Sorry, are you going to say something? I'll let you say. Sorry.
No, I couldn't agree more.
Yeah, and then what I noticed then, and you mentioned this earlier, Susan, about the comparison when looking at post, after picture, after video, there's a real sense of, am I adequate enough? How do I compare? And that leads to a deeper sense, an amplification of that sense of inadequacy. So there's a few various mechanisms, I guess, in my worries, but yeah, go on, sorry.
But I think what you're highlighting here is that knowledge that when young people are struggling and when young people are troubled, they are turning to the internet. And just like we see, and my apologies to anyone from the United States, but just like we saw in terms of the US election and Trump and that notion then of people going into increasingly narrow social worlds, they do that on social media as well. And so in terms of what we call the pro-ana websites, in terms of those that are promoting positive attitudes about anorexia nervosa that you would know, that these are incredibly negative sites for young people that are just disastrous for young people who have established eating disorders.
Yeah, yeah.
The majority of young people who are maturing in healthy ways, who are engaging and learning to live with the reality of social media that is with us. We can't put a lid on this genie. And so young people learning to be and learning to engage and learning the social etiquette of how to engage in the world is equally part of what they need to engage in the real world with you and I. But I think it is that there are then some particularly damaging dark holes, rabbit holes that people can go down to when they are particularly vulnerable. But I'd use the reverse of that as well, Daniel, because if we think of LGBTI young people, where we know growing up in a lot of communities where there is as even greater social sanctioning against sexual minorities perhaps than there is around mental disorders, that there are groups of young people who are particularly vulnerable. Then we can also see that the creation of online communities where they feel socially accepted, where they can feel that it is much more normalised in different cultures, can be hugely invalidating and very positive for young people's mental health. So again, that notion of that two-sided coin, double-edged sword,
Yep.
This is a very complex environment, and I think if there's anything we're learning from the literature, we need to be working much harder to be looking at the mediators and moderators of those impacts, not just looking at simple correlations or even directional association.
Agreed. Thank you, Susan. We've got so much more to discuss, but I think we've got to move on. So I'm going to move on now to the other side of the digital world in terms of how it can be a force for good and looking at digital mental health interventions. Before we go to Professor March, I just want to share a quick video, and this video is from KK Hospital. We're running a program using a very simple and engaging video as a digital mental health intervention. So I'll let you watch this, and the team will explain it much better than I can.
Somatic symptoms, also known as psychosomatic symptoms, are physical symptoms stemming from emotional distress. Here at KK Women's and Children's Hospital, we see a number of young people with these symptoms at our clinics and emergency department. The RECAP Lite program stands for Resilience in Children and Adolescents with Psychosomatic Symptoms. With this program, we aim to deliver an early, brief intervention that leverages simple technology in the form of an engaging video. The video serves as both a form of guided self-help for the young person and their family, and also as a therapeutic tool for healthcare professionals or community partners working with youth to deliver the intervention. This can help address symptoms as early as possible to prevent chronicity, as it allows young people to seek help within their own schools, community, and familiar environments.
Our advanced practice nurses use the RECAP Lite video as a therapeutic tool to conduct short sessions for patients needing some guidance to manage their physical symptoms stemming from emotional distress. This includes psychoeducation on the mind-body connection and coaching on a variety of coping strategies.
Watching the video gives parents and their child a good general understanding of what symptoms are, so our medical social workers can readily focus on family stressors that may be contributors. Using illustrations from the video, we can also equip parents to help their children feel better when the symptoms occur.
The Recap Lite program and video is about leveraging accessible technology to provide early comprehensive intervention. We are happy to share this self-help video for mild somatic symptoms. It can be found on the KKH YouTube channel, or you can scan the QR code on the screen to access this video.
Okay, that was the Recap Lite program. I was telling Olivia earlier before we started that I really want to make therapy like TikTok. And how do we do that? But we try very hard to condense this video to as short as possible, but actually the therapeutic video takes 15 minutes. That's how long it took to get all the key ingredients in there. Anyway, okay, we'll move on to Professor March. Professor March is going to tell us a bit about digital mental health interventions and her work in this space. Over to you, Professor March.
Thank you. And that was really great to see that video. We're doing quite a lot of work ourselves in the use of animations for children and finding it really powerful. So it's really great to see. Today I'm going to talk to you very briefly about how we have scaled up our digital intervention for child and adolescent anxiety, which is the BRAVE program. Next slide. And I just want to first disclose that this intellectual property is owned by UniQuest and the University of Queensland, which none of us are at UQ anymore. However, it may be commercialised in the future and we may receive royalties through that, but we are not at the moment. I'm just acknowledging all of my collaborators and students in this work. Next slide. So the BRAVE program, just to set the scene, is effectively an online cognitive behaviour therapy program for child and adolescent anxiety, targeting those anxiety disorders there, so the more common ones. And we have programs for children and adolescents, parents of children, parents of adolescents, and also parents of preschoolers. And you can see that the session length varies a little bit. Next slide. Just to give you a little bit of a taste of what it looks like, we use a lot of animations and colours and characters and games and quizzes to keep young people engaged. BRAVE itself is an acronym for the strategies that young people learn throughout the program. And there's lots of interactivity. So it isn't just a video, or it isn't just psychoeducational information. It's a combination of all of those things completed over a 10-week period for children. Next slide. So I wanted to just very briefly give you a bit of an idea about the evidence base for this type of program. And there are other programs out there that have been trialled in different disorders and also for anxiety. We've now been running this program, I think this is the 20th year since we've started doing this evidence. So we started quite early and we've done 8 randomised control trials and then real world open trials as well. So we've been progressively testing different models of care. Next. First, we started with blended internet CBT and face-to-face. So we actually did every second session in the clinic in a group setting and then online for the other session. Then we moved to fully online with all content delivered on the computer and just a little bit of email therapist support. So really just checking answers and providing some feedback. We then moved from that to the one I want to talk about in the next little bit of time, which is our open access nationwide self-help program. Now, this is completely self-directed. Young people, parents can do this completely on their own, and they have all the tools embedded within the platform to help them do that. So that one you'll see in a moment has a lot more reach. And just in the last couple of years, we've actually now trialled 2 different stepped care models where we let young people start the self-help program on their own and we assess their improvements, and halfway through, if they haven't shown substantial improvements, we step them up to receiving therapist support, either by email or by video conferencing. Next slide. This slide here gives you a bit of an overview of how they all work, these models of care. And they all have different advantages and disadvantages. And so I think a theme coming through with all of the presentations so far today is it's not simple, and there isn't one answer for everything. And I think for us, what we've found with our models of care is that each of these models of care is useful and potentially of worth to include in an overarching model of care. So you can see here that the highest efficacy is seen when you mix in more of the therapist contact, which isn't surprising. But what we've actually found is that we can get just as good efficacy, in fact better, when we involve that therapist support weekly and in a minimal amount, as opposed to having to do every second session in the clinic. The more therapist support you include, obviously, the less reach you have as your model of care. And the self-help one, we've managed to reach many thousands of people. And engagement is also less when it's a self-directed intervention. So young people will stop sooner, or they'll take what they need and then move on. But the therapist time is less as well. So there's advantages either way. Next slide. So I just wanted to go through some of those barriers and facilitators for scaling up to that digital national platform. And some of the things that we really found with our self-help platform is that you needed to have a very clear target and knowing exactly who this is for, what sort of restrictions would you put in, are you going to offer any support or not, and you need lots of support from your local, state, national partners and you know, whoever is relevant there. We found it very beneficial to include advisory and co-design panels, and that's across the spectrum of stakeholders, clinicians, young people with lived experience, end users, consumers. And the other thing that was really important was having really, really clear referral pathways, knowing where people were coming from and, you know, which referral pathways were successful. Next slide. So just to give you an idea, we've reached 65,000 young people and parents through our self-help program, and you can see there from the graph where we get most of the referrals from. And largely speaking, it's from health professionals and school-based professionals. We did a lot of work in trying to promote via those avenues, and I think that's really important as a facilitator of this sort of uptake. Next slide. In addition to how you scale up, you need to think about how to maintain the service. For us with Brave and the self-help, we've really had to think carefully about, well, when do you make sure you let them know they need additional help? You need those trigger points for additional referral. You need to keep refining the program, improving the program and getting co-design and feedback from consumers. That's not always technical improvement. Sometimes it's about new components or new treatment techniques, and you know, you need to be ready to do that. Next slide. These are some of the improvements we've done over time, having guides for professionals and school teachers, adding clinician-based systems to the back end, adding much more visual progress charts for young people to keep track of their improvements over time, and interactive tools, app-type tools to help them create their exposure hierarchies. Next slide. So just at the end now, just finishing up by highlighting some of the barriers that we've found and tried to overcome over time. Really what we found with trying to go to large populations, and even when you're doing this, you know, with a clinician involved, the more assessment or data that you collect, the more of a burden it is for the young person, and they will not complete. So minimise the burden where you can. Have some really clear consent and risk minimisation strategies, because they're needed ethically and you know, without practice, but they can also act as obstacles to access. So if your intention is to make services available to people who wouldn't otherwise have them, you've got to really be careful not to make that too burdensome for them. Otherwise, the service just simply won't work. We have, over time, worked very hard to overcome our reluctance to use due to lack of awareness and knowledge about evidence-based, so a lot of promotion and education interventions for that. And then also being able to show how these programs are effective when you're typically collecting in a non-trial sort of basis has been challenging. Just ending, I think we need to think very carefully about, you know, when you do need a therapist, because these self-help programs are best for moderate and mild cases. When you do need a therapist, what is that ideal dose? And sometimes it's less than you think. Next slide. Thank you. That was all I wanted to talk about today, but I'm sure we'll have lots of questions.
Okay. Thank you, Sonia. The BRAVE program is really impressive. I think there's a lot we can learn from it. It is so much work that's gone into evaluating the work that you've done, refining it, and I think this leads us on to the next topic, because there's a real plethora of different interventions out there, and we don't know how effective all of them are. So I think this leads us on quite nicely to understand the future and to look and see what are the different ways we can disrupt mental health care in terms of interventions and accessing care. So I'm going to hand over the time to Dr. Tan, and I'm sure she'll tell us lots of different things that are happening at the MOHD. Dr. Tan, over to you.
Thanks, Vic. First, I'd like to thank Vic and Temasek for organizing this very timely and important and inviting us to be part of this. So for next slides, please. So for those of you who do not know what's MOHT, we are actually not MOH. We are a subsidiary of MOH, but Office for Healthcare Transformation. It started about more than slightly 3 years ago, and it's really anchoring on how we could bring all various partners to look into how to do data-driven, evidence-based decision-making better, as well as digitally enabled solutions that empower the individuals, prevent diseases, and providers, so that as a whole system, we could provide excellent value-based care. I'm from the Integrated Health Promotion with Dr. Priyanka earlier on. We look into how to understand the social, behavioral, and environmental factors that affect people in charge of their own health, well-being, and to look into how to use digital tools like digital mental health to help people. Next slide, please. So when Vic first asked me, can you talk about crystal balling of the future? First of all, I must say I'm from the vintage age. Happy to say that I'm officially the senior as of next week, 60 years old. So, whatever I can tell you is however much that I know a little bit of it. So from the World Economic Forum, they defined digital mental health as three main parts. One is the basic use of online support group, podcasts, blogs, and to the extent of the other part of it is wearing, wearable things, be able to use AI technology, innovative technologies to help, to monitor, and for individuals to actually understand what's my sleep pattern, how does that affect me? And then the other part, of course, is I think as what Sonia has also shared, that, using eCBT, virtual reality, chatbots, gamified way to improve the treatment experiences as what they call digital behavioral health. Next slide, please. So what's the difference really between digital mental health and digital health? Or telehealth for that matter. First of all, we know that, right, there are tons and tons of all these so-called claimed digital health solutions for everywhere, right? From consumer focus to business focus. So to me, the main difference is really for telehealth is supposedly to be part of digital mental health. But for digital mental health, the focus is on the individual. How do we empower and enable the individuals to be able to take charge of their health? Through the use of self-assessment, whether it's wearable or whether it's use certain form of digital solutions to help them. Next slide, please. So it is very much user-focused. For the individuals, whether you're youth or adolescents, we heard so much about in terms of stigma. So how can we use digital tools to help them to understand better, to know about their own emotional well-being, when they should help and where they can seek help, rather than having stigma as a barrier to prevent them from seeking help. And as I think, many people has also highlighted that a lot of times it may not be really mental ill. They may just have distress. So how can they actually also help themselves? But as Sonia rightfully pointed out, right, you need a little bit of the therapies. That's where the service providers part come in. So how could they link seamlessly to the providers, to the therapists, or to their doctors? And for the busy doctors like Vic, right, have to do so many things at one go. How can perhaps some AI algorithm, after the patients key in their thing, then he can see, oh, actually, she or he is not so unwell. Maybe I send her to my clinical therapist, or maybe just send them to the peer support network. That can help to increase the scalability and accessibility. And of course, for policymaker, decision maker to be able to have the data to drive research. And of course, like people like Prof. Wong, they have done a lot of research, but usually it's just like black we do research, right? It takes years to just get the data. But when we have digital means, we will have immediately within a short period, you can have some data and look at the trend as well. Next slide, please. But how to get there, right? We know, as Susan has shared, right? There's a lot of research, but there's really not enough as yet, right? Proof. And even for MOHD, we have our own little digital mental health tools called mylight.sg. We are then having to say, okay, in the space of self-empowerment, we are not targeting our people who are ill, but distressed. Is it useful? So we're going to embark on an evaluation on that. There are not many, if you look around in terms of research in the area of self-empowerment tools. And that's where there's a lot of queries about, is it right? How do I recommend which one is good for one? Then, of course, there's regulation issue, data security. And in Singapore, in fact, right, we were talking about today, we don't even have a governance system. For clinical psychologists, for therapists, there's no registration. So when people ask me, saying, wait, which one is better? I can't even tell them, right? I say you have to look at their experience, perhaps their background, perhaps the customer feedback and things like that. But that's major issues as well in itself, right? When you're starting to talk about how do I link, who do I link to in terms of that, and seamlessly without breaching. And of course, there's also issues for parenting consent, as you all know that in Singapore, right? If they are, 18, it's still considered as minor and with parenting consent needed. But on the other hand, do you stop the kids from reaching out for help? We do know that as well. And of course, very importantly is the mindset and change, right? Any change management, process change. And in fact, I learned recently like digital literacy is not equate to your ability to know social forums. So many of us, I think that, just know TikTok, know something, but literacy is just like health literacy. You need to know how to apply it, how to embed into the whole process of care and the journey of the user themselves. Now, the good thing is, of course, the World Economic Forum in their toolkits also highlighted, right, that giving us some broad guidelines in terms of how do you set the goals that will help to enhance the healthy individuals, community, and as a population. And then there's also a set of values, and most important of all is making sure it's effective, ethical, sustainable, and attributes such as being person-centric, cultural fit. And that's very important, right? Having the choice and accessibility as well. And focusing on early intervention, yet it's integrated data and demand driven. And in terms of standards, they highlight this importantly about do no harm. Clinical standards, the governance, the quality, and as well as data protection, privacy, and having the right business model. There are many private companies now jump on board all these things, but do they have the right business model and ensuring it's sustainable, it's accessible, and it's affordable to all age group, and it's very targeted. As we can see, right, some of us know that for the adolescents, perhaps, they will need the parents to come in there. And it's important, right, family, and we know that you can't separate the children from the family. Even though there are times that the children, I don't want my mom to know. But then how do you bring the mom on board? It is very important. And so these are the things that, that will also define in the future, what is it, the digital mental health team? Next slide, please. So while we all move towards building up these digital, solutions for empowering and enabling mental well-being, we do need to remember that digital mental health is the mean to the end, and not the end in itself, right? As shown also by Sonia, that you need to have the balance between having the digital means, empowerment, yet having the right people in time to help them as and when they need the support. So for those of you, let me just do a little advertisements of those of you who are interested to know about our mylight.sg, please do scan, or you can just type in www.mylight.sg. This is our little attempt to see how we could reach out to the youth and the working adults. Thank you.
Thank you, Weng Moi. I think there's a common thread that we're seeing here, that on the flip side of the digital world and the good things we can get out of it, we still need human beings. We still need a family. We still need our professionals that can build those links with us and help us understand what's going on. So it's that partnership, I think, and I've heard that from Sonia and I heard that from yourself. So thank you very much. We're going to now go to our last panelist for this morning. I'd like to introduce Ms. Olivia Chong. She's from TikTok, and she's going to tell us a bit about how we can make the online world safer, what they're doing now, and how they're kind of minimizing harm in terms of social media. Over to you, Ms. Chong.
Thank you, Dr. Vic. So just a very quick introduction of myself and my team and what we do at TikTok. So my name is Olivia Chong. I am a product policy manager with TikTok's trust and safety team. So I specialize in content policies relating to suicide and self-harm issues. And my global team, we're in charge of developing policies and approaches for content related to these themes. And I just want to say, before I dive deeper into the presentation, that we're so excited to be part of this conversation because we're very big proponents of working with civil society, with lived experience communities, and also professional healthcare professionals in this space. So I thought it might also be appropriate to just do a very brief introduction of what TikTok is for those of us who might not be as familiar with the platform. So we are essentially a short-form video mobile application. And there are just lots of videos on TikTok. There are videos about anything and everything you could think of, really. And my team, the Trust and Safety team, we specialize in ensuring that TikTok stays a safe platform for all community members. And in my presentation, I'm just going to go through some measures, what we've done in the space of mental health to try and mitigate harm for our users and create a safe and supporting environment. Yeah. So here are a list of some of the measures that I'll be going through very briefly, and we have divided them into 3 broad categories. So firstly, we have measures that we've taken within the app. Secondly, measures that we have in our online safety center. So this is a website that we have which is off the app. And beyond our app and our website, I also want to talk about our engagement with creators as well as the campaigns that we hold. So the first thing I will talk about is our community guidelines. Our community guidelines are essentially the rules of the road. They tell our users, what you can post on the platform or what you can't post on the platform, because you want to keep harmful content off the platform. It's also how TikTok as a platform defines, what is it that we stand for, what we will allow and what we would not allow, and provides these very simple rules that our users can follow when they are using the app. So in the space of mental health, we do have suicide and self-harm specific community guidelines. And very broadly, we say that we do not allow the depiction, the promotion, and the glorification of any content or any type of behavior that would lead to suicide, self-harm, or eating disorders. The second thing I want to talk about are our in-app resources. And for today, I would like to highlight our search intervention measure. So search intervention means that when a user types in a word that is related to suicide or self-harm into our search bar, these special results will pop up. You can see from the screenshot that we have on the slide that we embed hotlines of our local emergency services. We also embed tips directly in the app itself that our users can access. Users also have the option to opt in to view video results. And these video results, I want to highlight, they have been specially curated to make sure that they are suitable for a general audience. And they include videos which we've worked with our NPO partners to create. And these are mainly educational videos which encourage help seeking, as well as just providing information and resources on where users can seek help in this respect. The next thing I want to talk about is our Safety Center website. So moving away from the app, we also have additional resources for our users on our Safety Center. And we just launched this well-being guide in September last year in conjunction with World Suicide Prevention Day. And currently we have 2 toolkits within this well-being guide, and I'm going to talk about them very briefly. So our first guide is a guide to sharing mental health stories. So we have seen that there are so many young people who are talking about mental health, just wanting to share their struggles and their experiences on the app, but they don't necessarily know how to do this in a safe manner. So this guide was meant to address that. You can see some of the topics that we've included in the guide. I've listed them out here in the slide. but really we just want to provide them with the resources to be able to know how to speak about these issues safely so that we can all work together to ensure that TikTok remains a safe and supportive platform for all users. And the second guide that we have is a guide to supporting distressed community members. So we know a lot of young people are talking about their struggles online, but how do we actually recognize signs of struggle and how do we reach out to them? Research tells us that there are ways to offer support which are much more safe and much more effective than others, and this guide provides them with some tips and best practices. My next point will be on partnering regional experts. So we definitely don't work in a vacuum. We appreciate that suicide and self-harm, they are such nuanced topics. So we make sure to work with regional partners to understand the latest findings in the clinical sphere and to learn from the experiences of people with practical experience in these matters so that we can make evidence-informed policies. And my last point will be about our campaigns. So we also hold mental health awareness campaigns just to get conversations around this topic started. And in May and September last year, we held 2 mental health awareness campaigns where we partnered with our local NPOs to conduct live streams and to just highlight avenues and share resources with our users. And that brings me to the end of my presentation. Thank you.
Thank you, Ms. Chong. Thank you very much. So we've come to the end of all our sharings from our panelists. We're now going to go into our Q&A section. So they're going to restart the timer, hopefully, because it now says 0, which tells me there's no time for questions. Okay, there we go. We've got some time. All right. So I have a few questions here via the Pigeonhole already. And I kind of, if I could summarize them, I don't need it up on the board, don't worry about that. But there are certainly questions about the harm that we can get from, that young people might actually get from social media. And some questions are around the possibility of social media creating misdiagnosis when it comes to mental health issues like ADHD, bipolar disorders in youths, and how that can come about when young people watch some of that social media or read about it or enter into chat rooms about it. So the question of misdiagnosis is one, and also whether social media can also actually result in unrealistic beauty standards, as well as the issues around overly sexualized imagery and that self-comparison. So some of that concerns that people have in terms of misdiagnosis, as well as body image, beauty standards, those kind of things. We'll open it up to maybe the group of panelists, if that's okay, and we hear some thoughts about what they think about these things, and is it concerning? Is it something they're concerned about? Who would like to start off first? Susan?
I might jump in, Vic. As a paediatrician, I continue to see young people and certainly have been aware of a number of young people who have come to our clinic for assessment. This is an adolescent medicine clinic rather than a mental health clinic, with some specific questions and concerns and beliefs about self-diagnosis that have come from their engagement with the web. And whilst misdiagnosis, I appreciate, is obviously a possibility, in my own experience, I think I've been more impressed by the fact that they've largely been right. and I'm thinking particularly of a couple of patients with ADHD and a couple of other patients with autistic spectrum disorder. Both of these patients, these groups were on the mild spectrum that, perhaps were not as extreme as they were thinking. But I certainly think that for them, that exploration that they had done online was very helpful in a sense, normalising their experiences and then giving them confidence and perhaps helping their mental health literacy as a way of building their confidence to be actually then engaging with a health professional and asking some specific questions. So I certainly appreciate the risks, but I also think that it can be a route into accessing care or interventions. I mean, the other thing that I would put out there in terms of what I've seen is in terms of young people with transgender and a number of young people thinking that they might have this, whereas, and again, I've seen both scenarios where for some young people it's actually been the case, and for others it hasn't been the case, but it has been a route into conversations with other people in their lives, whether that's been school health professionals, teachers, or health professionals such as myself.
Thank you, Susan.
Since this question is on social media, perhaps I could chime in as well. So I guess when we're talking about misdiagnosis, from a platform perspective, the concerns that we have will be about, the propagation of medical misinformation. And so we take a very strong stance against this. We work with fact checkers to ensure that information, especially when it comes to medical conditions, they are accurate and that we are not promoting inaccurate content that can be harmful to our users. And what we also do to counter these problems, we are very, very strong proponent of working together with healthcare professionals, NPOs, so that we can onboard them onto the app and that they can work with us to create authoritative content on these conditions, which we can promote to our users, right? Especially when they, like I mentioned, search intervention, when they are keying in terms like that into the app, we want them to be able to show them authoritative information and just educational information that will help them rather than harm them. Yeah.
Thanks, Olivia. Any other thoughts from anybody else?
Hi. If I may chime in here,
yes.
As a mother, right? I think education is really key. And I think highlighted as Susan and many others about the fact that there must be understanding between the parents and the children and the youth, right? And having the literacy and knowing, what is harmful for them. While I think we can expect the companies to have some ethics, but on the other hand, the individuals also must learn how to make use of the digital tools and not just letting the tools define themselves. I know it's easy said than done, but I think it's something that we need to work on it. We have to accept the fact that social media, digital world is here to stay, and we can't run away. And it has helped us during COVID, right? So that's the part that I think the first thing really is education. And it's not just about educating the young, the parents themselves, and perhaps even all organizations, right? A whole of government, whole of societal kind of approach. So then the companies know what is not ethical, and the individuals also know when to do what and how do you make use of the digital means. So that's just my thoughts as a mother.
Thank you, Weng Moi. Thank you very much. Well, I think this kind of slides in quite nicely to the next question I have. It's not in Pigeonhole, but I've been thinking about this quite a bit. We know that it's not rat poison, social media, I mean. We know it's going to affect people differently, different groups of people differently. And the amount of time they spend, how they use it makes a difference. But we think about how can we minimize harm. And I know Olivia has talked a little bit about what they're doing at TikTok. But we think how we can minimize harm in terms of different groups in our society. Maybe we'd like to get some perspectives on that. So maybe start off, what can young people do? What can families do to kind of minimize harm when they notice something's happening in terms of their use? And maybe we can then talk a bit about what can government and healthcare do. I think Weng Moi has already alluded a little bit to this. Maybe you can think more about what can government and healthcare do in terms of minimizing harm. And last but not least, maybe we can think broadly speaking from the private sector, big tech, social media, what else needs to be done to minimize harm? Is it okay, Susan, is it all right we start with you in terms of youths and families?
Yeah. Look, I think I really agree with the comments that have been made in terms of the importance of building family or parental literacy, both in relationship to mental health, but also in relationship to digital media, and that notion of how do we build parents who can be sufficiently authoritative that they are able to provide supportive frameworks for their kids where they can actually respectfully and helpfully challenge their kids who they might be concerned are spending excessive amounts of time on social media. And so I think that's very much a role for school communities, individual schools, to be really taking leadership of, as well as governments, in terms of social media campaigns and some broader community-based interventions. And I think that this is part, Vic, your question, I think, was really focusing more on, if you like, early intervention. But I think we really need to pull it back and think about primary prevention and looking at whole populations and how is it that we can equip school communities, young people themselves and families with the skill sets and understanding about what is appropriate. And just like Olivia was explaining in terms of TikTok and in terms of their guidelines, I really think that in terms of school policy around digital media, we equally need some expectations about what is okay, because parents are flying blind here. Dr. Tan, it's not just you who's hit seniors. There's a few of others of us online as well, myself included. And, this is where older parents or even younger parents, don't necessarily have the resources, and their kids are not necessarily sharing or they're not typically at all sharing what they're seeing online, because that's not what young people do. But I think, again, we need to be careful not to be hysterical about this, because in relationship to young people and their peer-to-peer communications and the whole notion of adolescent development, it has always been thus, that the world of young people and their engagement with their mates, as we would say in Australia, is something that becomes highly distinct to that they engage parents with. Now, I do think there's some practical strategies, though. And I think if there's one practical strategy, it would be delaying the age that kids have access to cell phones, delaying the age that young children have access to iPads, delaying the age that digital media is viewed as a normal part of child rearing, where access to digital media becomes the babysitter, the way of quietening kids down, rather than requiring their parents and their families to be much more actively and interactively engaging with them. So I think a lot of the messages in terms of the primary prevention space are actually to be delivered to the parents of, this maternal and child health centres rather than secondary schools. It's really messages to be delivered to parents of very young children, and then primary schools, and only then secondary school.
Thank you, Susan. That was some really nice reminders. Do you have an age in mind when it comes to delaying the age? Are we talking about 21? Be a rebellion.
Nice one. Look, I don't have an age, but again, this is where the cultural context is really important, and we all know, kids who, and again, has always been thus, that, a kid will come home and say, well, little Susie around the corner is allowed to do that, or Sonia up the road is around to do that, or Weng Moi around the corner is allowed to do that. And we have always, as parents, got on the phone to Sonia's mum or Weng Moi's mum or dad to find out, well, I feel a bit uncomfortable about this, what do you reckon? And that's where, rather than allowing young children to establish their own cultures, young people are still desperately needing their parents to be acting in those protective ways that, again, going back to Hogwarts, we saw their teachers act in incredibly protective ways. And our young people, more than ever, in terms of the risks that they face in their social environments, in digital media and social networking platforms, are desperately needing families and schools not to be abrogating those responsibilities to students themselves, but to be engaging with young people. Now, one of the ways they can perhaps best do that is to be just curious, to be asking questions, not to be pretending they're experts when we know they're not to be knowing anything about the platforms, but sitting beside their kids, asking their kids, what is TikTok? I've got no idea. Show me what people do on TikTok. What have you posted on TikTok? I'd love to see it. That active engagement support and understanding that parents can build through that side-to-side parallel sort of activity with kids, I think is something that we should be encouraging.
Thank you, Susan. Maybe we can go on to, in terms of asking a bit about what government and healthcare can do. I think Susan talked about what education can do. Maybe we can hear from Sonia and from Weng Moi after that, if that's okay, really quickly.
Look, I couldn't agree more with what's already been said, and I think really from the government perspective, I think it does need to be as early as Susan's saying in schools, and so for us, government and education is very highly linked, and I think providing that support to our education providers in being able to set those limits a little bit more. I think it's very difficult for young people and parents to set those limits themselves, but if it's instigated by the schools and the government supporting the schools, then I think that's much more helpful. I also just want to highlight, I think, as an additional point, couldn't agree more with what Susan's saying about how parents need to get more involved, but I think we also need to think about parents and adults modelling of these behaviours as well. And, you know, it's all very well and good to be attempting to set limits with our children around what they're doing or explore what they're doing. But if we're not also understanding how social media and how other, social networking is used and impacting adults, then we might continue modelling that behaviour, which will make it difficult for young people to change, I guess. So, the government could also be helping in making sure there are recommendations and guidelines around what adults should be doing and modelling and understanding the impacts that this might have on adults generally as well.
Thanks, Sonia. Weng Moi, any final comments? Because I've been told that this is the last one. I'm sorry, Olivia.
Okay. Yeah. So my phone also rang then. I must say that I really agree. First of all, it starts with the parents, and I think as government, we know in Singapore we have many rules. We are the rule countries, and we're so used to having the rules. When there's no rules, we all get very nervous. No U-turn. Do I U-turn or do I not? But I think it boils down that it has to be a whole of society, and I think education is the key. And having the open conversation. So education is not just like having the knowledge telling you what to do, right? Like what Daniel earlier mentioned. It needs to be a two-way conversations, understanding the role modeling. And so the government, I guess, whether it's in school or in terms of when we set certain boundaries, and this is something that in Singapore we're still learning. In fact, I co-chair with the Ministry of Health, Digital Mental Health Strategy and Plan. We are now looking at what are the best practices overseas and to understand, right, how do we set a certain framework such that we could allow a thriving, we can't run away from the fact that digital tools are going to stay, right? Digital mental health is going to stay. So how we ensure the balance between having the safety and ensuring no harm done and delivering what is needed, yet allowing the individual's rights as well. So to me, a basic framework, like for example, I'm an ex-pharmacist, right? So I use the analogy of food. So we all know what is food. Then we define what is supplements, right? Vitamins, and how much do you want to control the vitamins, right? Versus what is medicines. So when you start getting the things in terms of when the social media or the digital tools get into therapeutic effects, right? For example, we talk about ECBT, then there must be certain stricter rules and regulations. But if you're looking at using social media as a way to engage, as a way to educate, maybe a little bit supplements like vitamins, we can then perhaps have a little bit more relaxed rule, but having more education, understanding, and having that conversations in terms of even including when the Health Promotion Board or the hospital, the healthcare providers, and the schools in terms of highlighting the good and the bad part of it as well. So I know I have no answer, but I think to me, I like what Susan earlier on showed, the yin and the yang. We cannot care too much and control too much. We also need to learn how to be able to engage. Yeah, that's what I think I can comment on. Thanks.
Okay, thank you, Weng Moi. That's, I think, all the time we have for today. I'm so sorry we couldn't finish all the questions. I want to thank the panelists, Professor Sawyer, Professor March, Dr. Tan, and Ms. Chong, for coming and joining us today. I'll close by saying that actually, fundamentally, we are social beings, human beings, and we're very connected in this day and age. Maybe some would say actually overly connected. And the truth is that as we remain so connected via the digital world, we cannot lose connections with each other in the physical world. And that's so important in this day and age, both in terms of minimizing harm, as we heard, within families to make sure that we're keeping track of our kids and having those conversations, as well as making those digital interventions really meaningful when we add on some of that face-to-face experiences with our therapists as well. Okay, so I'll round it off here and pass it back to Jennifer. Thank you very much, everyone, for attending this session, and we look forward to the next session. Thank you. Thank you.